Dear friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varova. If you are first time on my channel, I'm qualified, practicing and licensed physiotherapist here in a sunny and very hot Cyprus right now in the summer. And I work both offline and online, and my specialty is pelvic floor. Pelvic floor, everything pelvic floor related, everything pelvic function related. And also I work with things beyond pelvic floor as well. Today, this video is for my beautiful pregnant moms. And usually I make this video with the extra, let's say, belly, just to separate the pregnancy, non-pregnancy videos, but it's really, really hot right now, so I decided to skip that part. Nevertheless, today I will show you a couple of relief exercises for a very common condition that I've seen in pregnancy. I would say every other pregnant who comes through my door for physiotherapy suffers from this condition. And the condition is hip pain. And the hip pain can be anywhere. It can be around the side of the hip, it can be more at the back, it can refer front, but the one thing is for sure, it's around the hip. And quite often it's debilitating. Moms, they can't walk properly, they limp, they have pain, they can't sleep, they can't turn, they basically cannot function. And many people believe that, and moms themselves, that this should start somewhere in the third trimester, when you get a bit heavier, your posture changes. But no, the hip pain can come on even very, very early in pregnancy. Sometimes it's hormone triggered, sometimes it's an old injury that's been there, and a tiny change in the hormonal status and a slight postural shift that might not be obvious can trigger the pain. If you do have a chance to visit a physiotherapist who specializes in pregnancy, that would be great. And manual therapy can give a great release, but sometimes it's just not really feasible or you don't have access. So today I will show you couple of exercises that can give you a relief from your hip pain at home. For that purpose, we will need a foam roller. But before, if you are watching my channel and if you enjoy my videos, if you are using any of those exercises, please like this video. It helps me a lot and motivates me a lot. Subscribe to my channel not to miss any new videos. And also let me know in the comments which movement did you find useful, which exercises and which videos did you find useful, and feel free to ask any questions. I will be more than happy to create more videos about your questions. So foam roller. I choose myself a soft foam roller. They're the ones that have a harder core and on top there is like a soft bit. Those usually are a bit too hard for pregnancy because in my experience, you're a little bit more sensitive in pregnancy in general for pressure, for pain, and those hardcore, the rolls with a harder core can apply quite a lot of pressure. So I would choose something like a foam roller, and this size is enough. And this is like top investment. Honestly, I've suggested this so much to the people. They were buying it. I should really starting to get commissions from the shop for selling foam rollers, all right? So if you get this, you can use it for upper back, for inner thighs, and I have plenty of videos in my channel that uses exactly the same foam roller for different conditions, including pelvic floor for men. But anyhow, I'm now sidetracking. Let's get down to business. First of all, a very quick, very basic anatomy lesson. Quite often, the hip pain comes from so-called sacroiliac joint, where your sacrum joins the ilium, the big pelvic bone around here. And this white bit here is actually a ligament, is really big. And sometimes this ligament goes into tension, sometimes it's shortened. And of course, there's a lot of muscles around, the gluteal muscles that can become tight, then go in spasm, and also the back muscles that are really close here. So everything is in the hip proximity. So we want to release really the whole area, not just that single point that we feel pain. And therefore, with the roll, we target 3 areas: back mobility, sacroiliac joint mobility, and gluteal mobility and muscle tension release. As I said, it's better to have a shorter foam roller because it's not going to be on your way when you put it down. You can also use a block for this particular exercise, but we will need a roller later on. So let's assume I'm having pain on my left side. This is my left side, all right? I'm placing my painful side on the roll and having my non-painful side down. So by now I'm creating asymmetry in my joints, and I will be able to have mobilization technique whilst doing the movement. I'm pregnant, imagine, belly, right? So I'm getting my feet a little bit and knees wider, and I'm starting to make a gentle wave movement. I'm starting to breathe in, tucking my tailbone in. And here, please focus on opening and elongating the bottom part here of your pelvis, not so much pushing through your upper back, which also can happen, but really tucking your tailbone in so it faces down. Breathing in, and as you breathe out, you come forward and stick your bottom out and breathe in. Really stretch and breathe out. As you can see, I'm fixing myself with my toe so that the roll is not going up and down. But as I said, for this particular exercise, you can also use a block. The important bit here is that your pelvis is in asymmetric position. So I'm mobilizing this area here, breathing in and breathing out. Tucking my tailbone in, going back. I can go further down, depending how big is your belly. As soon as you're comfortable, going a little bit deeper and forward. And you want to repeat this exercise about 12 to 15 times, nice and slow. Even if you have pain only on one side, I would suggest you also to do it on the other side, to make sure you give an equal stretch on both sides, because one side can be stuck, the other side can be a little bit hypermobile. So we really want to do it on the both sides. And out, and we repeat about 12 to 15 reps on each side. And that one is done. We're actually going to use roll for a self-massage technique. And this technique, guys, is universal. It's great. It's amazing for anyone who has any pelvic tension, but especially in pregnancy, because it's safe, it's easy to get yourself in this position, and I use it a lot in my pregnancy classes. So first of all, you want to sit on your tailbone, on the roll, okay? Let's say, my left side is painful. I'm placing my left leg onto my right. So remember, my left side is painful. And I'm rotating on my left side. And here, I'm starting to roll up and down. Right now, I'm rolling on my soft bit. I'm rolling on my glutes. I'm not rolling over my bones. I'm rolling over my muscles. And you can go up and down, rotate a little bit in and out, and usually you will find a tender spot. A spot that really hits it. It can even refer into your hip, into your back. It can really reproduce your pain. So find a spot and roll it gently, breathe through it. I have a lot of tension in my glutes. And myself, I had this pain exactly in my pregnancy, my first one, and I used roll a lot. If the client comes to me, I work through manual therapy and release those muscles manually. I also work on the joint mobility, but as I said, if you don't have an opportunity to visit a therapist, manual therapist, this is a great alternative, and that's done. You can do it for about 2 to 5 minutes or until you find a relief. And of course, you can also do the other side even if you don't have pain on the other side. Moving on. We are going to use the roll for another 2 exercises, but this time laying on your side. Again, my left side is the painful one. I'm laying down on my left side and I'm placing the roll slightly under the angle. The most important, it should anchor my knee. The bottom leg, you can keep it relaxed. Support your head, get your back nice and straight, and here you really want to rotate your knee in without leaving the roll. So lifting your heel, breathe in and out. And we're going to rotate, breathe in and out. You might feel that your back moves along with this movement. Absolutely fine. You just want to go nice and slow, breathing in and breathing out. Waking up those tight muscles, in and out. In case this movement, because it's more active movement, is like muscle work movement, causes you more pain, which may happen, all right, we just skip it. We can skip it and do a little bit more rolling until you feel better. Great. And you repeat it about 12 to 15 times, slowly with the breathing. Again, I would suggest you to do it on the both sides. Don't skip the others. Last but not least, we are laying down and placing the whole leg on the roll. The bottom leg is straight, but you can bend it slightly to hold your balance. And here again, we're mobilizing and we're stretching that space between the joint, right? We're kind of gapping the joint here between the sacrum and the ilium. So I'm going to roll forward. I'm trying to keep my upper body fairly still. I'm not kind of going forward anyway. You won't be able to do it with the belly. And I actively push it back, like somebody is pushing through your hip. I don't just go forward and return. I take it further back, further back, further back, further back, like somebody is pushing through my knee and forward. Breathing in and breathing out. Honestly, where you breathe in and where you breathe out is not that essential in this particular exercise. We're not doing pelvic floor, we're not doing engagements, we're mobilizing. The most important things, guys, just keep breathing. Just don't hold your breath. Okay, forward and back. My upper body stays relatively still whilst I'm rolling forward and back. And of course, I would suggest you to do the same on the other side, unless it causes particular pain on the actual pelvic side or painful side, which usually is not the case. All right, and that was it. This whole routine should take about 10-15 minutes. You can do it every day, even twice a day if you need in the beginning. Just the exercise where you do the pelvic rolling, I would suggest to see how you feel, because sometimes if you overdo it, if you do 2-3 times a day, every day, the area might get irritated because of the direct pressure on the tissues. Otherwise, you can do these exercises every day until you get relief. And if there is an opportunity and possibility for you and you still have pain, make sure you visit either your doctor or pelvic floor physiotherapist or somebody who is specializing in manual therapy in pregnancy. I hope, guys, you enjoyed this video. I hope you find this useful. Let me know if you tried any of these exercises. Maybe you've chosen one and you enjoyed. Maybe you did all of them. Let me know. Let me know how far you were when you started pregnancy hip pain. Thank you for watching, and we will see you back very, very soon. Take care.